Dr. Sunil Kumar, uh, Professor of Medicine, Srinivasa Institute of Mukka, and also a consultant physician at Dr. Sunil's Medic Clinic, Surathkal. Today, we'll talk about what is hypertension, what are the clinical features of hypertension, what are the complications of hypertension, and how to control and prevent hypertension. As most of you are aware, hypertension is a very, very common problem. It can lead to many complications. But for that, you should know what is hypertension. So normally, when heart beats, it pumps blood into the blood vessels. With each beat, it generates some pressure and it puts the blood. Send the blood to the blood vessels. When the blood moving through the blood vessel, it produces lateral pressure over the blood vessels. So the pressure exerted by the moving blood column, which is generated by the heartbeat, is called as blood pressure. The normal pressure will be usually below 120/80. If it is more than 140/90, then we call it as hypertension. We're coming to that. What is hypertension? Okay. But before that, who are the people who are at risk for hypertension? Commonly, once you get older, hypertension is commonly seen in old patients. About 40 years of age. Now you can see because of our change in lifestyle, change in our lifestyle pattern, dietary habits, we see hypertension in young people also. But earlier days, hypertension, why it is common? Once we get older, our arteries become stiffer. That's why hypertension, that when the pressure will be more in the artery, that's why you get hypertension. The people with lack of exercise, those who are in sedentary lifestyle, they are called office. Those are working in the office. They don't do regular exercise. They're also more to prevent hypertension. As you know, hypertension is a lifestyle disease. Most of the lifestyle diseases like diabetes, dyslipidemia, heart problem, they're in such category of people also. Hypertension is very common. Another group is the family history of hypertension. Your parents, mother, father is having hypertension, then you are also chances. Hypertension is not genetically inherited disease, but it can cause genetic predisposition. That means when the parents are having hypertension, you are genetically predisposed. Your chance of developing hypertension is more. Though the hypertension is also common in those persons who are taking more salt, who take regular alcohol, there's an excess amount of alcohol, those are taking, they smoke. These are the other risk factors for hypertension. So there are so many risk factors. The genetic runs in families, there is smoking, lifestyle, age patient, there are hypertension. Then what are the clinical features of hypertension? There are not much clinical features. Hypertension is called silent killer because there's not much clinical features which make the people to go for a doctor to monitor their blood pressure. It is silent killer. Silent killer means it presents with complication of hypertension. Straight away, patient may having cardiac problem. They may be having heart attack, cardiac failure, or they may be having stroke. There is paralysis in the limbs. They may have kidney failure. They may be eye change, eye problems. So they have different variety of complications of hypertension. Then they may not have symptoms of hypertension. They have without any complication, they will less symptoms. They may have lightheadedness, headache, giddiness. They may be having weakness, fatigability, loss of concentration. These are the symptoms of hypertension. But most of the time they are asymptomatic. When the patient go for health checkup, then they go for health, and then hypertension be detected. Or hypertension may be when they admitted with some other problems. When they admitted for fever or some other issues, that hospital when they record blood pressure, they may be having hypertension. They found that they may be having hypertension. These are the common symptoms. So that's why you are giving awareness about hypertension. So the patient, if you have to once you become a cross 40, At least annually, go to the doctor, record your BP. Because if you record the BP early, you can prevent the complication. If you control the blood pressure, you can prevent the dreaded complication of hypertension like heart attack, stroke. So these are the complications you can. That's why everybody. This is the main the awareness really because recording the BP, the detection of hypertension is very easy. Just want one sphygmomanometer. Sphygmomanometer. That is record the BP measuring machine where you can record the BP. So hypertension don't have any common symptoms. They don't have much symptoms. It can be easily can identify the hypertension by recording. If you go to your family physician, they record. They can detect your hypertension within 5-10 minutes. Within 5-10 minutes, they just record your blood pressure with thermometer. You can even detect the blood pressure at home also. Now, so many ambulatory BP monitoring devices are available, which are comparatively more accurate now. The present day recording BP record, that's why easily record the blood pressure. That's why last May 15th, we have celebrated World Hypertension Day. The more basic idea of celebrating World Hypertension Day to create awareness about hypertension, and so that more of the people know that what is their blood pressure status, and they come to know that they have hypertension, they can easily prevent the complications. So the theme of World Hypertension this year, monitor your blood pressure, control it. If you control it, control the blood pressure, live longer, live happy life. This is the theme of present year's hypertension day, World Hypertension Day theme. Okay. Now, as I already mentioned, what are the complications? How to record hypertension? That hypertension is normally blood pressure will be less than 120. Normal for LG person, blood pressure will be less than 120/80. If it is between 120 to 140, then we can't call it a borderline hypertension. Above 140, we call it as hypertension. That is systolic. Diastolic, normally it should be less than 80 to 90, you can call it a borderline hypertension. Above 90, it is diastolic. And what is systolic blood pressure? What is diastolic blood pressure? Systolic blood pressure means that when the blood pressure generated in the blood vessel, the heart contracts. Okay, that is called systolic. Diastolic blood pressure means the blood pressure recorded in the blood vessel when heart relaxes. That is diastolic phase of the cardiac cycle. So this is called as systolic hypertension and diastolic hypertension. So what are the complications of hypertension? This I already mentioned during introduction. Complications is it can cause heart problem. It can cause heart attack, it can cause heart failure, it can cause any other heart-related illness can be caused by hypertension. It can cause eye problem. The patient can cause a blurring of vision, patient may have retinal hemorrhage, blindness can be caused by hypertension. It can cause kidney problem. Patient may have chronic kidney disease. The patient both the kidney failure, they end up in dialysis or kidney transplant. The patient may have stroke. Stroke is one of the important problems. Stroke means cerebrovascular accident. That's why patient may have paralysis. They may have either hemiplegia, they may have monoplegia, they may have facial paralysis, they may have loss of consciousness. So many other problems. So hypertension will have many complications. That's the idea of creating awareness and preventing complications of hypertension. Now, once if you detect it to be hypertension, or you want to prevent hypertension, what are the strategies? Strategies, as I already mentioned, hypertension is a lifestyle disease. To prevent hypertension, we should know what are the, already I mentioned, who are the people at risk for hypertension. Most important is regular exercise. Exercise is a simple tool to prevent hypertension. You can do regular exercise, regular aerobic exercise, which is better for hypertension people. Aerobic exercise, you can, whatever the exercise you interested, whether you can do bicycle, cycling, you can do regular jogging, you can do brisk walking, dancing. These are the types of aerobic exercise. At least you have to do 30 to 45 minutes per day, at least 5 times a week. That itself is enough. Right? But the exercise is a very cheap method without any. There is no need of your money You only require time. That's not. That's not. It is a simple way to prevent hypertension is do regular exercise. Regular exercise. Whatever the you interested, you can that exercise you can do. Next step is diet. What are the dietary methods which can prevent hypertension? Dietary is salt. High salt intake is one of the most leading one of the cause for hypertension. You have to prevent. The intake of salt should be less than. So if it is sodium chloride, it should be less than. Salt is should be less than 5 grams. If it is only sodium, it should be less than 2 grams. The salt will be there in your food. So normal food, whatever uh, food is, whatever regular cooked food will not have much salt, but added salt like pickles, papas, they have more salt. Salads, if you take, then also you can have more salt. Then processed foods. Processed food also contain more salt. Processed food, bakery foods. The bakery food are processed, though they not taste salty, they contain more salt. That's why we have to add more salty foods. The uh, high fat diet, right? But fatty food like non-vegetarian food, baked food, they contain more fat. That should be reduced. That should be reduced. High fatty diet, the patient with their atherosclerotic problems, the complications will be more common those who take a high fat diet. The next important thing is DASH diet. What is DASH diet? Dietary approach to prevent stop hypertension. That is the full form of DASH. Dietary approach to stop hypertension. DASH diet is important thing to prevent hypertension. DASH diet means the diet which rich in vegetables, rich in fruits. Because the fruits will contain more of potassium. Potassium is good for hypertensive people. The DASH diet is important. The vegetable is always good for any to prevent either diabetes, to prevent cholesterol, prevent hypertension. DASH diet is but so diet habits. Then diet rich in this potassium. That's how I mentioned. Vegetable fruits is good for hypertension. Then other diet other things to prevent hypertension is quit smoking. Smoking is injurious to health. It can cause many problems. One of the problem of the smoking is hypertension. That's why if you're a smoker, you have to stop smoking. Next is alcohol. Alcohol also not good for hypertensive people. Though it can cause many problems along with hypertension. It can cause cardiac problem. It can cause other social problem with hypertension. That's why if you're alcoholic, stop alcohol. If not able to stop alcohol, at least leave it to 1 or 2 drinks per day. Then stress management. This is one of the problem is now present day problems. Stress management. So stress management is preventing. Uh, so everybody the stress. Everybody will have stress. Everybody in the life will have stress, but you know how to manage your stress either by relaxation technique, yoga, or you can do meditation. You can do regular exercise and do to prevent that will this relaxation technique will help to relieve your stress. That's why overall, if you have more stress, more stressful jobs, then better you control your stress. You should know how to manage your stress. So these are the important tips to prevent hypertension. And you go regularly for check your blood pressure. If not able to go, you can record your blood pressure at home. If the BP is high, then consult your doctor. Good, take regular medication. You have to always take that medication to control hypertension. So these are the important tips to control and prevent hypertension. Important things are basically since it's a lifestyle disease, regular exercise and dietary lifestyle, DASH diet, less fat food, your obese, even low calorie food also benefit to reduce your hypertension. And diet rich in vegetables and fruits is always better for diet. So this is the most important message I want to give. Control your hypertension. If you have hypertension, if you don't have hypertension also, to prevent hypertension, you record your regularly record to prevent hypertension. For good healthy lifestyle. So hypertensive patients control the hypertension with diet and exercise, and if you are on medication, regularly take medication. prevent the complication of hypertension, live healthy life, and live longer. Thank you one and all.